The water sources, yeah, it's important for everybody. We know that in the future there will be serious water problem all over the world.
Okay, Assalamu'alaikum Warahmatullahi Wabarakatuh. Hello everyone, it's Bülent and Akmal Bakhtiar as a host speaker in this section, and we are come back in Islamic Public Health Podcast. So, in order to celebrate this World Environmental Health Day, we are from Specialization of Environmental Health. Syarif Hidayatullah Islamic State University Jakarta invited Professor Dr. Bülent KiliÇ as a visiting professor, and today we are going to discuss about global environmental health issues, especially environmental health practices in Turkey. Before that, it is now my pleasure to introduce our guest speaker, Professor Dr. Bülent KiliÇ. He is an academical staff since 1998 in Docus Eylül University, Faculty of Medicine, Department of Public Health, and his lectures about health management, health policy, health system, health organization, and medical sociology for PhD, MPH students and residents in the Department of Public Health. As of the end of 2022, out of a total his publication is 373 publications.
Okay, last but not least, since our guest has arrived in this podcast, hello, Professor Bülent.
Hello, nice to meet you. Thank you very much for inviting me. I'm very happy to be here.
Glad to hear that, Professor.
Terima kasih.
Sama-sama. So tell me, Prof, how's your day?
Good, fine. Thank you.
Okay, glad to hear that, Professor. So, Prof Bülent, did you know that in Indonesia, we have celebrated World Environmental Health Day on September 26. Until now, most of the SDGs or Sustainable Development Goals achievement are mostly environmental health issues. This shows that Indonesia's and environmental health still need improvement. Among the SDGs targets are like need for clean water, garbage problem, waste disposal, air pollution, and climate change. So tell me, Professor, what about Turkey? Does it have the same problem?
Yeah, they are the same problems, but maybe we can divide the problems in two main components that they are different from one component to other component, that developed countries and underdeveloped countries. So underdeveloped countries, or like Turkey, Indonesia, developing countries, maybe we can call developing countries, they are the same but different, a little bit different problems. But when you look at the industrial countries, developed countries, they have a little bit different environmental problems. So when we look at Turkey and Indonesia, especially, for example, accessing safe water, drinking water, is a problem in everywhere. Air pollution is another problem. So, but when we look at, for example, developed countries, maybe global warming and maybe sustainable urban planning, urban problems, the main problems, or some chemical exposures are the other environmental health problems. But when we look at Turkey, especially there is another effect of global warming, climate change. The climate change is a problem that affects all the countries, not also developing, also developed. The both group are affecting. But the developed countries are trying to slowly change for the climate, but for our countries, we don't do anything to solve this problem. So the climate change affects our countries, like as floods, like as forest burns, forest fires, etc. So we can divide the problems simply two main components like this.
Right, because as we know that air pollution is one of global issues, and based on the journal that I've read before, around 80 out of 81 provinces in Turkey are exposed to air pollution, and an estimate 30,000 premature deaths occur every year due to air pollution. And how you as a public health can dealing with this situation? Is that true or?
Yeah, that's true. That's completely true. Air pollution is a very big problem, and we publish every year a black report. Black report contains the air pollution statistics in my country for every city, and it says that the air pollution problem is increasing in Turkey. And as you mentioned, the premature deaths are increasing related to air pollution. And also, we have a very bad indoor air quality. This depends on also the rapid urbanization, rapid industrialization. Maybe we can look at Jakarta, we can see the same problems. The rapid urbanization means that there are many people, millions of people live in a city, so the traffic is very complex and very high, and some heating or cooling depends on energy, and this energy comes from some centrals that works by coal. Coal means the old-fashioned energy, and when we fire the coals, it means that a very big air pollution problem in the city. So when we look at Jakarta, for example, we can see air pollution. And also in our cities in my country, we see especially the cities that are crowded, and some in the cold area, some heating problems. If there is not a natural gas, or there are poor people that they cannot get energy, natural gas energy, they use usually traditional coals, and it makes air pollution in all city. So the air pollution is a serious problem, and our efforts should be focused on preventing air pollution and also indoor air pollution caused by inefficient energy resources and inefficient cooking materials in the houses.
Okay, so Prof. Bülent, in Indonesia, we didn't process our garbage very well yet. Like example, in Jakarta, there's a place called Bantar Gebang, so we stack our garbage in that place. The question is, how Turkey proceed waste disposal and garbage?
It's another problem. As you know, in the urban cities, the population increases day by day, and there are many wastes, the house waste, also industrial wastes, and also medical waste in the hospital area, as you know. So in order to address the problems that may increase, waste collection systems should be improved. Firstly, waste collection, and secondly, recycling. Recycling means that you should use the materials again and again. So waste reduction should be encouraged by recycling, and for this, appropriate disposable facilities should be established to minimize the negative effects of human waste. So for recycling means also a new kind of economy. In the economy, in the old time, there was a classical economy that production is very important. You should product day by day. Many many glasses, many clothes, many cars. But in this time, we call this a new approach to this problem, circular economy, recycling economy. It's an industrial term, but it means that transformation and recycling is important. And this is in front of the production. I mean, this is a base instead of production. So we use the old used disposable materials to earn again, and especially for technologic materials and chemical materials also. So the three principles needed to transition to a circular economy are designing our waste and pollution, keeping products and materials in use, and regenerating natural systems. It's important. We regenerate the natural systems again and again. So these measurements can be taken by the governments. The circular economy should be come instead of the old classic economical methods.
So, Prof, I have another question about clean water. There is a problem clean water in Turkey because in Indonesia, even though we have any water sources, we have many rivers, but our rivers is mostly polluted by waste. And how about in Turkey for water sources?
The water sources, it's important for everybody. We know that in the future there will be serious water problem all over the world. So we have to keep the water resources all together. I mean, it should be a solidarity between the countries. And for this, we have to take some measurements about nature-based solutions and green infrastructure. What I mean that, for example, green infrastructure means that a network of a natural and semi-natural areas with other environmental features designed and managed to provide a wide range of ecosystem. So this means that keeping the water resources, water purification, improving air quality. This means that there is a network between the green and blue. It means that green means the forest and the blue means the sea, oceans. So we keep the balance between the green and blue, and we keep them. We keep them, and this network improves the quality of environment. So it also keeps the water resources. Another solution is nature-based solution. Nature-based solution means that this means restoring and protecting natural habitat. So natural habitat, forest, ocean, all the green infrastructure should be kept and increasing, especially in the urban area, greening areas, the lakes, and using the natural environment in the cities. And this should be improve the water resources and also all the other natural resources. So we have to take measurements about the nature-based solutions. We have to adapt the nature. Okay, we should look to the nature, and we have to adapt to nature. We don't press or stress the nature. If we do it, we can lost this war between the nature and human.
Maybe for sanitation in your country, how is the sanitation? Is it good or like what?
Yeah, sanitation is quite better in my country, especially after the COVID-19 pandemics, many people learned that sanitation is important, washing hands especially, and keep the environment clean is very important. And so sanitation problem is only there is in the poor houses, poor districts, poor villages. The hygiene problem is still going on, but in the urban area, usually we have a good hygiene. But in the urban area also we have some slum settlement areas. That slum areas sometimes they have an infrastructure problem like water and collecting the wastes. In that place is also hygiene problem. But if there is no poor, there is no poverty. I mean, you can find everywhere in a clean way. So to supply, to have a hygiene, you have to defeat poverty. Okay, you have to tackle with poverty.
So the point is we need to defeat the poverty, to restore all the health problem in Turkey.
Poverty?
Yeah, poverty is the key.
Yes, of course. In all countries, not also in Turkey, in Indonesia, in England, in Sweden, in the United States, poverty is the main reason of health problems. If you are, there are many research about the poverty. Firstly, if you are poor, there is a chronic stress in your life. So it means that you are every time worried about the future. You are every time worried about your children, about your family. This chronic stress affects the cardiovascular system, heart diseases, ischemic heart diseases especially, heart attacks, and to affect immunization system, and they can get cancer, or they are living in a very bad social environment and they are smoking, etc. They are not exercising, they are only working. So it means that if you are poor, if you are unemployment, if you have not a job, it means that your health is not good.
Okay, I found the point. Okay, Professor, I think that's it for now. Thank you for coming here, Professor Bülent. We hope this podcast can provide a new perspective for us as a civilian in Indonesia, so we can partake to create a solution, like example, like a new policy. It has been our pleasure to host this podcast. Thank you so much, Professor Bülent, and thank you for your time to coming in this podcast. See you in the next session. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.